I think berberine is a good option. I used to take berberine before I had metformin, and I was taking a gram every morning. But again, it's also insoluble. So think about the yogurt and the oil options as well. It can be additive, meaning that it can be beneficial to take both. And again, you do that under your doctor's supervision, of course, because it's actually quite a strong combination. But it can help if metformin isn't sufficient or berberine on its own is not sufficient to bring down your blood sugar levels or improve your overall metabolism, then the combination can actually work even better.
So the real interesting question, as you mentioned, you knew people that don't have type 2 diabetes that are taking metformin, right? So the real question is, well, what about people that don't have type 2 diabetes? Like, we want to get a tighter control on our blood glucose levels and our insulin sensitivity. And probably one of the studies that sort of sparked that interest was a large study, a prospective study that showed, it was like 78,000 individuals. Some of these people took metformin. They were people with type 2 diabetes that took metformin. And some were people with type 2 diabetes that did not take metformin. And there was also some that took another type of drug. I forgot the name of it. But the interesting thing was that the people with type 2 diabetes taking metformin lived on average. I should also mention there were age-matched controls that did not have type 2 diabetes.
Right.
The people with type 2 diabetes that were taking metformin lived on average around 15% longer than the age-matched controls without type 2 diabeties. Like, that's what got my interest. That's what I was like, that's the study that really piqued my interest, where I was like, okay, what's going on, right? Or okay, so you said healthy individual and take metformin, or are you a healthy individual and you exercise? So there was a large randomized controlled trial done by the U.S. Diabetes Prevention Program. I don't remember when this was published, a few years ago. They showed that 150, this is a randomized controlled trial, okay, 150 minutes of moderate intensity exercise per week prevented the progression of pre-diabetes to type 2 diabetes by about almost 60%. So people with pre-diabetes that were assigned to this exercise group to do 150 minutes of moderate intensity per exercise per week, about 60%, preventing the progression, right? Now, the other group was also people with pre-diabetes. They were given metformin, and metformin prevented the progression into type 2 diabetes by 31%. So exercise, that moderate intensity exercise, 150 minutes a week, was about twice as good, right? Now the real question is, what if you were a healthy individual that exercises like you, me, and probably most of your friends in Silicon Valley are, and you took metformin? Is there a synergistic effect, right? Is there an additive effect?
Right.
Like, that's the real question. And I'll tell you, multiple randomized controlled trials now, not just one, not just two, not just three, not just four, more than that, have shown that the opposite seems to be true, where taking metformin in the context of either aerobic exercise or strength training exercises seems to blunt many of the positive effects of exercise. So let me get a little more specific there. There was a randomized controlled trial published, I believe it was a year ago or something, that was done, because there had been multiple ones done in people with type 2 diabetes or pre-diabetes, showing that metformin could blunt some of the positive effects of exercise on insulin sensitivity and things like that. But this is like one of the first real randomized controlled trials done in healthy individuals that were at risk for type 2 diabetes, but didn't have type 2 diabetes, okay? They were basically given increasing doses of metformin, starting from 500 milligrams and then increasing up to 2,000 milligrams, depending on their body weight. And this was a 4-week trial, so it was about a month long. And they were doing 45 minutes of aerobic exercise on elliptical 3 times a week. Metformin prevented the exercise-induced improvements in cardiorespiratory fitness by 50%. Other randomized controlled trials have shown this to be true in people with type 2 diabetes, and also there's one other study in health of active adults. So that's really concerning. Cardiorespiratory fitness is one of the biggest predictors of disease and mortality. So that is really not good that metformin, prevented it by 50%. It also inhibited improvements in mitochondrial respiration, and that may be something linked to I didn't talk about all the mechanisms of metformin. One of the molecular mechanisms that's thought to play a role in improving, all this glucose regulation and insulin sensitivity is the activation of an important pathway called AMP kinase. That pathway is activated by energy stress, and energy stress can be caused by things like exercise, can be caused by fasting or caloric restriction, or metformin. Another thing that metformin does, and it's actually even thought by some people that this is how AMP kinase is activated, is by basically disrupting a certain part of the mitochondria that generates energy, called complex 1. You've got 5 complexes inside your mitochondria. They're basically just passing electrons around, and this is how you can make energy in the form of ATP. Well, metformin disrupts one of those complexes, mildly disrupts it, complex 1. For the longest time, I wasn't hugely convinced by that, because the majority of data was in vitro, meaning you dump metformin on cells in culture, and this happened. And it's like, well, that could be a really big dose-dependent thing. Most in vitro studies, you can show one thing and completely show an opposite thing if you were talking about what's called in vivo, or at the level of the whole organism.
Mm-hmm.
But there was a study published a few years, like 2014 or 15 or something like that, showing if you fed rats, they were rats that had type 2 diabetes, and they were fed various doses of metformin, 30 milligrams per kilogram body weight, 100 or 300 milligrams, right? Showed that at higher doses, 100 or 300 milligrams per kilogram body weight, metformin could decrease the mitochondrial oxidative capacity, specifically linked to complex 1 activity, if they isolated muscle from these rats that were orally given these doses. So I was like, okay, that's evidence that it is obviously doing something that's physiologically relevant. So that could be why it's, preventing cardiorespiratory fitness, which has been linked to mitochondrial function. It could be why it's in metformin's inhibiting adaptations with mitochondria. Metformin also diminished whole body insulin sensitivity after aerobic exercise, but it wasn't like everything was bad. So metformin didn't diminish other improvements from exercise, like the decrease in HbA1c, which is like a long-term marker of blood glucose levels. It didn't affect fasting insulin or blood glucose or fat mass or skeletal muscle telomere length, which increased with exercise. So that's good. But it is concerning that it had all those negative effects, right? And these are in healthy people. So the activation so here's the thing. That's the question, right? Well, what if you time your metformin, right? There's things to consider other than the half-life of metformin, or, the important thing is, so for example, exercise activates AMP kinase. The activation is relatively transient, but the effects of exercise last about 48 hours. Metformin activates AMP kinase, and the effects of metformin last about 36 hours after the last dose. So is it the AMP kinase activation that's responsible for these effects? We don't even know. It's not even known. Or how long is the complex 1 inhibition lasting after you take your last dose? Is that also 36 hours after? We don't know. They're open questions, right? Not to mention that there was just, a couple of months ago, another randomized double-blind controlled trial showing metformin. This was also in healthy adults that were doing resistance training, and they were older adults. Both of these studies were older adults, age 65 years and older. But this study also showed that after 14 weeks of taking about 1,700 milligrams of metformin, which is quite high, and this gets back to your friend's anecdote, the participants that took the placebo gained more lean body mass, and also thigh muscle mass compared to those who took metformin. So metformin blunted some of the gains in muscle mass.
Right.
It also diminished the strength, but those results were not statistically significant. So it's trending towards, because glucose levels, like glucose dysregulations, heavily tied to, disrupting brain health. It makes sense that improving blood glucose levels and blood glucose regulation improves brain health. So there have been some clinical studies showing that metformin in people with type 2 diabetes taking metformin can improve cognitive function and things like that, which is almost certainly linked to the improvements in, glucoregulatory improvements. I say my thoughts, my concluding thoughts on this is that I think exercise is better than metformin for preventing type 2 diabetes. That's been shown. Treating type 2 diabetes, but also I think it's better than metformin in delaying aging. I think that you're better off doing exercise than taking a metformin pill. Now, I don't think the effects are going to be synergistic. So, is there a place for metformin? Absolutely. I mean, there are tons of people that will never exercise, right? So you sit down, you tell someone you have to exercise 150 minutes a week or you can take this pill. They're going to be like, give me the pill,
Right.
Yeah. But that doesn't mean that, we don't know all the other side effects of metformin, or for people like you and I, that it's not just about laziness. It's about wanting the best, right? I want the best. So currently my thoughts on the field are the best is exercise. And I am not convinced that taking metformin in addition to exercise is good. In fact, I think it's actually not beneficial for people that are exercising. And you can do this whole argument, I'll take it on days I don't exercise, but we don't know how long the effects of this metformin. Like I said, 36 hours after the last dose of metformin, you still have AMP kinase activation. AMP kinase activation, by the way, inhibits mTOR downstream. And part of the blunting of the muscle hypertrophy effects of resistance training, it's thought, at least the authors of that randomized controlled trial think, has to do with the fact that mTOR was not being activated enough in the muscle because the metformin was kind of dampening it too much. Again, it's not just about, well, how long does metformin stay in my system? Then I'll exercise on a day when it's not in my system.
Right.
This comes down to, you can look at anything. You can look at things like, using the sauna, activating heat shock proteins, which we can talk about. But, like those effects last for 48 hours after you get out of the sauna. There's lasting effects on these molecular pathways that it's perturbing, right? So that's what you really need to consider, not just the bioavailability, the half-life of the compound that you're ingesting.
This medication is normally for diabetes type 2 and PCOS, polycystic ovarian syndrome. And it basically does two things. It helps increase sensitivity to insulin. So it improves insulin resistance as well as the suppression of glucose production from the liver. Okay, because if your liver's making too much glucose, it's going to raise the sugar. So metformin will chill that out and increase the sensitivity. So here's the hormone insulin, here's the receptor. It comes in, it makes the connection, and there's resistance. It allows the insulin to work better in the cell. Okay? Well, that sounds great, but two things. One is the actual root cause is rarely addressed, like the high levels of sugar in the diet are rarely addressed. The frequent eating is rarely addressed. If that was addressed, you could eventually improve it without metformin. So one of the challenges with metformin is that it not only has side effects, diarrhea, nausea, abdominal pain, gas, but it has a boxed warning, which is a very severe warning based on the FDA, that will spike lactic acid, okay, which can then severely affect your pH and create a lot of more serious problems. Also, it blocks the absorption of B12 and folic acid. So that has a whole series of side effects connected to that. And in addition to that, you don't want to take metformin if you have a liver problem or a kidney problem. But who doesn't have a liver problem or a kidney problem if they're pre-diabetic in the first place? So it does come with a package. So there are some natural alternatives that you can use in addition to metformin. And by the way, check with your doctor before taking this recommendation, okay? But you can research Berberine, which helps improve insulin resistance, okay? Cinnamon, goat's rue, green tea, bitter melon. All of these improve insulin resistance. So it's something to do research on as a way to possibly avoid these side effects. Berberine, okay? Berberine is the next turmeric, okay? It is actually incredible. It's been thoroughly studied. A lot of people know about it, but they don't know all the different things it can do. Some hardcore research on a lot of things, especially the cardiovascular system. It's a very powerful anti-arrhythmic natural compound. Now, berberine is a phytonutrient in certain plants, okay? So it's not necessarily a name of a plant. And because the mechanism of arrhythmias involve calcium, berberine can decrease the intracellular calcium, which is one actual cause of the heart going out of rhythm, because calcium is an electrolyte. If there's too much calcium in the cell, it becomes toxic and it affects the electrical system of the heart. It can also decrease blood pressure. It can increase the performance of the actual heart muscle itself. It decreases the risk of heart attacks protects against ischemia in heart muscle. This is a lack of oxygen. If there's some type of obstruction because there's a clogged artery that's causing a lack of blood flow to the heart muscle, this can help it. Also, it can alter potassium channels. Now, potassium is a mineral that protects excessive amounts of calcium going into the cell. And this is why certain arrhythmias are actually caused by low potassium. Because if you don't have enough potassium, you can't protect against the excess amount of calcium that builds up inside the cells. Berberine can help as an anticoagulant, so that can help reduce clotting. Number 2, and this is a well-known benefit, can decrease infectious diarrhea. So if you have an infection that's causing diarrhea, I would start taking berberine. All right, number 3, it can act as a natural antibiotic, okay, which actually explains number 2. It's also an immune stimulant. It can help boost your immune system. Number 5, anti-tumor, anti-cancer, big time. In fact, there's just a lot of studies going on using this berberine on tumors and cancer, which you don't hear about unless you actually dig in to find this data. Number 6, and this is actually a very important benefit, it has anti-diabetic properties. It can potently decrease your blood sugars. It can help with insulin resistance, making insulin and glucose more sensitive. So your blood sugars are going to be much better. There's been some reports that this will work just as good, if not better, than metformin. I realize I'm not making any claims. Check with your doctor before consuming this, but you may just want to read the research yourself. All right, number 7, it can help decrease the effects of caffeine. Caffeine can trigger arrhythmias. Well, berberine decreases the effect of caffeine. All right, number 8, it's anti-inflammatory. It's very, very effective for anything that has itis, bursitis, tendinitis, arthritis, and it's antiviral. Other than that, it probably doesn't work for anything else, and I'm being very, very sarcastic. This is the next turmeric. I think it's a very powerful phytonutrient that I think more people need to know about.
Berberine, it is commonly used in Chinese medicine for treating diabetes for centuries and centuries. That's one of the reasons we added berberine in our supplement. Some of you are aware of the Sugar MD Advanced Glucose Support. We use berberine in there, and we use bitter melon, and we have a total of 12 different ingredients to help you guys manage your diabetes a little bit easier. Now, why did we choose to use berberine in our supplement? Now, as I said, the berberine has been used for centuries, but we need to understand how it really helps diabetes. So, primary mechanism is something that's not going to make too much sense to you, but I'll say it anyways. Cellular mechanism called AMP kinase. That's an enzyme that almost works like a molecular signal switch. So it helps you to improve your insulin resistance. It makes your body break down the glucose better and faster. As a result, when your insulin resistance improves, your cholesterol, your HDL, your total cholesterol improves, even your LDL improves as a result of use of the berberine. It also improves the gastrointestinal flora. The good bacteria goes up. It also helps reduce the absorption of carbohydrates or breakdown of carbohydrates. Now, that's one of the reasons that sometimes too much berberine can cause side effects, just like metformin does. What is interesting, yes, metformin, a lot of people hate it, but it works very similarly to berberine. Now, why berberine is preferred by some people? It's because it's totally natural. It comes or extracted from the plants, unlike a pharmaceutical that is just something like metformin. But for both agents, for both metformin and berberine, you may have gastrointestinal distress like a lot of people get from metformin. So as a result, instead of using 1,000 or 2,000 milligrams of berberine, which is commonly sold if you look at Amazon or other channels, you will see those, but be careful, you may have a lot of gastrointestinal distress. So we added around 300 milligrams of berberine per serving, because we have so many other things in it, and to be honest with you, you can put only so much in a capsule, so we have to decide how much of which substance, supplement, natural ingredient we need to put in those tablets or capsules. We use tablets typically, but capsules can be used as well. The bottom line is berberine overall helps your diabetes, but like any other supplement or medication, it is not a miracle worker. It is one of the things that helps you control your diabetes better. It is relatively safe. Again, you should discuss with your healthcare provider if you are wanting to use higher dose of berberine. But the bottom line, it typically helps. It takes a little while. It also helps with the weight loss. I forgot to tell you about that. In a modest fashion, not significant. But a lot of my patients who will take, for example, our Sugar MD supplement will tell me that their cravings are much better. Recently, berberine has come under the spotlight in the Western world because of its ability to regulate blood sugar levels. Also, it activates longevity pathway, right? AMP kinase, adenosine monophosphate activated protein kinase, which is the metabolism master switch that helps with the weight loss and even fight cancers. Now, because of all these advantages, berberine is actually beneficial supplement for delaying aging and increasing the longevity. Now, the positive benefits of berberine in diabetes and obesity treatment are partly due to the stimulation of AMP activated protein kinase signaling pathway, AMPK, if you want to look it up. It is a mouthful, isn't it? Yeah, AMPK, an enzyme found in cells, in most cells, is a metabolic master switch that helps control cell energy. It is one of the pathways we want to trigger with our Sugar MD Super Berberine, for example, which is a blend of dihydroberberine and Ceylon cinnamon. And if you remember, dihydroberberine is 5 times more absorbable than the berberine and has far fewer gastrointestinal adverse effects or side effects. Now, how does berberine really work, right? When ATP, which is the cell powerhouse, the ATP levels are low, the berberine activates AMPK, which in turn modulates the signaling pathways to replenish ATP supplies in cells by ramping up fatty acid oxidation. So in other words, it enhances your energy and helps burn fat, right? Doesn't make it simple. What's made berberine even more popular is that it's equally effective at managing blood sugar as metformin, which is a known prescription medicine, right? That we use for type 2 diabetes as a first line. But without the adverse effects of metformin, you can get the benefits, the similar benefits from berberine. Now, how do you compare the berberine supplements and metformin? Although berberine and metformin, they are pretty distinct structurally, right? They have several benefits in common. However, many individuals, for various reasons, are wary of metformin. I see that all the time in my practice. Berberine is a type of supplement that is definitely helpful in the management of diabetes, and I use it. The Super Berberine is the evidence for that. It's structurally somewhat similar to metformin. It helps actually to increase the insulin sensitivity and lower the blood sugar levels. However, there are some important differences between the two, okay? Berberine is derived from a plant, while metformin is a synthetic drug. Additionally, berberine has been shown to have other health benefits beyond the blood sugar control, including improving your cholesterol levels and reducing the inflammation in your body. Finally, berberine is not associated with severe side effects, unlike metformin. Overall, I would say berberine is a safe and effective option for those looking to manage their diabetes with or without metformin. You can use in addition to metformin, or as an alternative to metformin. Berberine has been subject of many investigations, right? A lot of research. Those studies have revealed that it can really control blood sugar levels, help lose weight, and improve cholesterol in many ways. It's not a miracle, but it helps. Berberine also reduces, like we said, insulin resistance, and that results in increased responsiveness to the insulin, so you don't need as much insulin in your system. Berberine works to lower blood sugar levels again by, remember that, activating the enzyme called AMP kinase, which then causes the muscles and the liver and the adipose, which is fat tissue, to take in more glucose instead of running in the blood. Now, it boosts the rate at which glucose is metabolized within the cells, which we call as glycolysis, and it contributes to also our gut's ability to break down the carbohydrates more slowly, so slows it down, okay? So it prevents the blood sugar sievings. It contributes to the regulation of microbiome in the gut, vital to function of many our systems. Now, it reduces the amount of sugar that is produced by liver, which is another plus. Now, in a research, participants with type 2 diabetes and high cholesterol, they were given 1 gram of berberine per day, for example, in one study I'm citing here. They have seen a reduction in their fasting blood sugar from diabetic to normal levels. Now, of course, their blood sugars were not in the 400s, but just above the normal level. The study findings led the researchers to conclude that actually berberine is effective and safe for especially people with diabetes who are not struggling with super high blood sugars. So if you have a mild diabetes, pre-diabetes, A1C less than 8, I think it can help. Now, dehydroberberine, which is just 200 milligram of it, is equal to 1,000 milligram or a gram of berberine. So make sure that you also consider dehydroberberine. So now you're probably thinking, which one is better, right? Is berberine better or metformin better? I wouldn't necessarily change one or the other. You can use them both. There is no reason to stop metformin unless you want to. But both will help you manage your weight and lower your cholesterol levels and your blood sugar levels. On the other hand, like I said, the side effects are much less with berberine and actually dehydroberberine more than anything else. So for those reasons, especially dehydroberberine is an alternative to metformin if you have too many side effects to metformin. Another advantage of berberine or dehydroberberine is that you can just purchase it without a prescription if you don't have time to go to the doctor, right? Can berberine help with weight loss and PCOS? That's also a common question. Now, as you know, PCOS is called polycystic ovarian syndrome. It can result in excessive cholesterol, insulin resistance, and difficulty reducing weight. A lot of young women struggle with that. But according to a lot of research, again, berberine does the same thing that it does to diabetics. Improves the response to insulin, decreases the waist to hip ratio, control the cholesterol in women with PCOS. Although berberine is not a miracle for weight loss, generally affects with the weight loss overall, especially if you have a BMI of 30 or over. Again, according to 2 other studies, berberine supplements or taking berberine supplements for 3 months causes noticeable weight loss. When I say noticeable, at least a few pounds, like 3 to 5 pounds. That's because of it is, help with the regulation of the insulin. Overall, berberine is a plant extract that is safe to take orally. It can still cause some side effects, and the most common side effects are similar to metformin side effects, such as gastrointestinal distress, that could be nausea, that could be vomiting or diarrhea. Berberine also causes lightheadedness in some people, or drowsiness, or dry mouth even. Now, in very rare cases, berberine can, of course, cause severe side effects as well, so you just have to make sure that you're monitoring that. Low blood pressure occasionally happens, so if you already have a blood pressure that's on the low side, be careful. Now, that's why we use dehydroberberine and sugar MD superberberine, that is a modified form of berberine, to allow better absorption and give less side effects. And of course, don't forget that the Ceylon cinnamon is very complementary to dehydroberberine. They are both still 100% organic and natural. So think about this. Are you a person maybe who shouldn't be taking berberine, right? Yeah, well, if you're pregnant, if you're breastfeeding, probably not a good idea. That's a more sensitive situation, your baby, and you, there's not a lot of studies about those. So I would stay away from that, from berberine or dehydroberberine. Again, if your blood pressure is super low, like down to 100/50 or lower, taking berberine or dehydroberberine may cause it to drop even lower. So either you have to adjust your blood pressure medications or you have to stay away from it. Guys, that's pretty much it. I think we kind of touched base a lot of things today about the berberine and dehydroberberine. And if you have any questions, please don't hesitate to ask.
Hi everyone, this lesson is on what to avoid if you are taking metformin. So we're going to talk about some beverages and dietary choices that can influence the side effects that can occur from metformin, but most of this lesson is going to be basically a pharmacology lesson where we're going to talk about a lot of medications that can interact with metformin.
However, metformin can cause a variety of mild and severe side effects. Some of these include hypoglycemia, which is a low blood glucose level. So it can lower the blood glucose level too much, although this is a rare side effect. But we're going to talk about some other medications that can interact with metformin to increase the likelihood of this happening. And metformin can also lead to some other side effects, including headaches, diarrhea, and also a severe condition known as lactic acidosis, where the blood becomes acidic. So those are some severe side effects that can occur, and this is why it's important to make note of some things that can increase the risk of these side effects from metformin use. Before we get into those, there are certain patient characteristics that increase the risk of having side effects. One of them is liver disease, another one is kidney disease, another one is heart disease, and having a recent myocardial infarction or a recent heart attack can increase the risk of having these side effects as well. And then a previous allergic reaction to metformin. If someone has had a history of an allergic reaction to metformin, this is also another risk factor as well. So most of these, liver disease, kidney disease, and heart disease, if a patient does have them and they're on metformin, they are at an increased risk for lactic acidosis. So very important to recognize if a patient has these patient characteristics. But there are other factors that can increase or decrease the risk of metformin side effects, and we're going to talk about those in the next upcoming slides. So some dietary choices can increase the risk for metformin side effects. These include alcohol consumption, especially excessive alcohol consumption. So drinking alcohol, again, especially heavy alcohol consumption, can increase the risk of lactic acidosis. This is the very serious condition that we talked about before, and it's very important to recognize. Now, alcohol can also increase the risk of hypoglycemia, which is a low blood glucose level or low blood sugar. So very important to recognize as well. So for patients on metformin, it's important to avoid alcohol consumption or at least limit alcohol consumption, because this alcohol consumption can also contribute to liver disease, which can also increase the risk for lactic acidosis as well. And another important point to make note of here is that if there is excessive alcohol consumption and excessive exercise around the same time, this can lead to an increased risk of hypoglycemia as well for patients that are on metformin. So I just want to mention that here as well. Grapefruit consumption may also increase the risk for metformin side effects as well. So consuming grapefruits and or grapefruit juice can increase the risk of side effects from many, many different medications. The reason is because grapefruit and grapefruit juice can inhibit certain enzymes in the liver that metabolize many different medications. Now, this is a bit controversial with regards to metformin. It may cause an increased level of metformin to accumulate within the liver, which can ultimately lead to an increased risk of lactic acidosis, but there is limited evidence with regards to this. So although grapefruit consumption can increase the risk of side effects from many different medications because of its interaction and inhibition of drug metabolism, the evidence with regards to metformin interactions with grapefruit and grapefruit juice is limited at this point, but I want to mention that here as well. Now let's talk about different prescription medications that can interact with metformin to increase the risk of side effects from metformin. Before we get into those, it's important to consult your physician or healthcare provider with regards to the following medications. So if you are on these medications, it's important not to stop them before talking to your healthcare provider. Some of them are going to be contrast media. Now, this is going to be important when you're in hospital and getting imaging done. Contrast media can interact with metformin. Some of these include iodinated media, ioversol, and metrizamide. So these are some contrast media that can interact with metformin. What they do is that they actually decrease the renal clearance of metformin, leading to elevated concentrations that can ultimately increase the risk of some of those side effects we talked about before, including lactic acidosis. There are certain chest pain medications that can also interact with metformin. These include ranolazine. So ranolazine can interact, decreasing the elimination of metformin, leading to increased levels of metformin. So again, another important medication to recognize. So as you can see, there's going to be many different medications we're going to talk about here. So it's going to be very pharmacology focused. So it's going to help a lot with pharmacists and pharmacy students for the next upcoming slides. Some other medications that can interact with metformin include tefenoquine, which is an anti-malarial medication. So you can remember quin, chloroquine would also be another anti-malarial medication, but this one specifically, tefenoquine, can increase the level and effects of metformin. So this is one to avoid if a patient is on metformin. Selegiline is also another medication that can interact with metformin. Selegiline is a monoamine oxidase inhibitor. It's actually a Parkinson's disease medication. And if a patient is on this can increase the level and effects of metformin as well. We can also see certain diuretic medications interacting with metformin to increase the risk of side effects from metformin. So certain diuretics can increase the risk of lactic acidosis. So it's important to monitor them, especially in patients with other underlying health conditions. So a lot of times these diuretic medications are going to be used in patients who have liver disease and have heart disease. So it's important to monitor these patients, especially if they're on metformin as well, to make sure that they are not going to experience lactic acidosis. One of those diuretic medications is the very commonly used diuretic known as furosemide or Lasix. Some carbonic anhydrase inhibitors can also interact with metformin to increase the risk of side effects from metformin use. So certain carbonic anhydrase inhibitors can increase the risk of lactic acidosis, and these include topiramate and methazolamide. So these are very important to recognize as well. And topiramate is used for treating migraines and epilepsy, and methazolamide is a treatment for glaucoma. So two medications that should be thought about when a patient is also on metformin, because these both increase the risk of lactic acidosis. Certain antibiotics can also interact with metformin as well. These include the fluoroquinolones like moxifloxacin and ciprofloxacin, macrolides like clarithromycin and trimethoprim, which is part of Septra, and cephalexin as well. So use of these antibiotics may increase the risk of lactic acidosis. The interactions are going to be a little more minor, but if a patient is taking these antibiotics along with some other medications that cause minor effects on metformin, they can accumulate and increase the risk of lactic acidosis. Some other commonly used medications that can interact with metformin include the ACE inhibitors like ramipril, lisinopril, and captopril. These actually increase the effects of metformin, and they may increase the risk of hypoglycemia. So this is going to be very important to think about, because a lot of patients can be on ACE inhibitors and also be on metformin. So again, the risk is going to be very minor, but if a patient is on some other medications that also cause very minor changes in the way metformin works, they can add up and cause or increase the risk of certain side effects. And with regards to the ACE inhibitors, they can increase the risk of hypoglycemia. The use of certain antidepressants can also interact with metformin. These include the SSRIs like sertraline, which is Zoloft, fluoxetine, which is Prozac, fluvoxamine, escitalopram, and paroxetine. Bupropion can also interact with metformin as well. Most of them are going to have very mild effects. Some antidepressants increase the levels of metformin, others increase the effects of metformin. So again, very, very mild effects on metformin pharmacodynamics, but with multiple medications, if a patient is on multiple medications, it's important to think about, because these can increase levels or increase the effects of metformin. We can also see interactions with cimetidine. Cimetidine is actually an H2 blocker used to treat heartburn. So use of Cymetidine may increase the effects of metformin as well. Now, those are some more commonly used medications that can interact with metformin to increase the risk of metformin-induced side effects, but there are other medications that can also do this as well. If you want more information on all of the medications that can interact with metformin, please check out some of the resources on some other medical reference websites for more information on this. Now, I want to end this lesson on something that can actually reduce the risk or reduce the side effects from metformin use. And that is actually supplementation with vitamin B12. Long-term use with metformin can actually lead to a vitamin B12 deficiency. So because of that, it can lead to vitamin B12 deficiency signs and symptoms, which are very important because they can be irreversible in some cases. So a lot of them are going to be neurological, like symmetric paresthesias, issues with two-point discrimination, and issues with proprioception. And patients can also experience signs and symptoms of depression as well. So metformin can lead to a vitamin B12 deficiency, especially with chronic use. So I do want to mention here that supplementation with vitamin B12 during metformin use is very important. So we can get vitamin B12 from a variety of food sources or from supplements. So I want to mention that here because we can reduce the risk of vitamin B12 deficiency and reduce the risk of signs and symptoms of vitamin B12 deficiency.